Good evening, my viewers. Welcome again to Health Matters program, where we discuss health issues and learn so much more about it. Today we have a very beautiful speaker called Susan, who's a health promotion officer at the county of MERU. I'll invite her to greet us, then I'll tell you what topic we'll be talking about. Karibu, Susan.
Thank you very much. My name is Susan Mudon. I'm the county health promotion officer, as you have heard. And we are glad to have you again in the topic related to matters of health, because we usually say that knowledge is power.
So karibu sana, my viewer. Today we are talking about hypertension, or what we normally call blood pressure, BP. This is what we'll be discussing. I'd like to start off our guest by asking her what hypertension is all about. Okay,
hypertension, it is a condition where we have high BP, blood pressure.
Yes.
Because usually say that everybody has got blood pressure.
Yes.
We take blood pressure. We usually have the normal BP and abnormal BP. When we have less BP, that's when we say that you have increased blood pressure. And the condition, we call it hypertension. It occurs when we have either, to say in the normal status, we usually have the blood flowing to all parts of the body through the arteries. The arteries carries oxygenated blood pressure, that is and the vein carries in the oxygenated blood, the blood which has got no oxygen. And the oxygenation of the blood starts from the lungs, and it is taken to the heart, and the heart does the work of pumping, so that the blood can circulate to our blood in a narrowed area. At the end of the day, we will have accumulated pressure in the blood vessels, and that is the time when you take the reading using a BP machine. You end up with increased blood pressure, and in that case we can have two readings. Two readings we call the systolic and the diastolic. In systolic, it is when the heart is pumping the blood into the vessels, and in diastolic, it is when the heart is in relaxation mode, because it doesn't pump throughout. It pumps less in our well, pump less in our well. That's how the condition occurs. And I've said that the condition is called hypertension. The reading we call the reading the blood pressure readings. But in the layman language, you find that mtu anasema niko na pressure. Yes, uko nayo. But in the real understanding, because watu wameelewa ni kwamba ukisema uko na blood pressure, we understand it is when you have increased blood pressure readings, and the condition is what we call hypertension. It can occur to anybody, even to the children, even to the adult and men, though we know that because of the risk factors, most of the time we have more numbers of women having their blood pressure than the men. And the children, they also, because we have some issues to do with the pregnancy, hormonal issues. The use of pills can predispose one to blood pressure, depending with the type that you are using. If it's not under control, we can also have increased weight, overweight. Most of the people that have got overweight in their ladies.
Okay.
And also issues to do with the estrogen, the way the body is made up. Those are some of the predisposing factors to why ladies may be having hypertension as compared to men. Yeah.
Wow. I thought it's because,
for men, they have low health-seeking behavior. Like we say, men go to hospital when they see blood, when they have in serious pain, when they cannot talk.
When they are completely broken.
But you encourage the viewers, it's good you go for medical checkup. Even when you are not sick, to know how you are faring. Because actually you find that most of the people, they are working with high BP, because you find that in hypertension, most people we usually say that the hypertension is a silent killer.
Yes.
Reason being that in some cases of hypertension, there are no signs or symptoms.
Oh, yeah.
Yeah, hakuna signs, but you can too. That's why we encourage us that it's good if we have a medical checkup.
Yes.
Yeah, when you look at the classification or types of hypertension, we can classify them into 3 stages. Let me say number 1, there is what we call primary hypertension. We have the secondary hypertension and the gestational hypertension. In primary hypertension, this is where that classification is according to the causative agent at the time the BP started. So in primary, that is when the cause is not known. It is either genetical, and the one is born with the status. For example, you can get it in children because of congenital disorders. The other one is what you call the secondary, caused by either to modifiable factors, like you have the increased weight, can be caused by either taking too much of cholesterol foods, taking alcohol, smoking, can also be either due to use of drugs and painkillers or pills. They predispose one to drugs, and also due to stress. Those are modifiable factors. And the modifiable factors, you see that you can work on them and quit getting from this condition. In the same secondary cause of hypertension, can be due to other other conditions, chronic conditions. In the chronic conditions, like we have thyroid, we also have diabetes, we also have kidney disease, and also liver disease or any other disease that is in the body that may predispose one into getting hypertension. Though we say that in whatever kind of condition that you may be having, it's good you adhere to medication and also to the clinic follow-up to avoid getting another condition.
Let me ask you, now you say it's very hard for someone to know whether you're hypertensive, like just a normal person. What are the symptoms? What should we expect us?
Okay, for example, when I get to the CDC classification of hypertension, even according to the WHO, they classify hypertension into another categories. So in this classification, that's when now I will give what is the feeling. For example, in the normal hypertension, in the normal reading blood pressure, it should be reading between 100 to 120 systolic, and the diastolic should be reading from 60 to 80. That is the normal. Now, when the reading looks at, now we read them into millimeters in mercury. When we have a reading which is from 130 to 139 systolic, and 180 to 89, we call it elevated BP. Another type is when you have 130 to 89 and above, that we call it hypertension type 1. In hypertension type 2, it is when you have 140 over 90 and above. In this kind of categories, like you have the elevated and hypertension type 1, most of the time you just have a mere headache.
Oh, just a headache.
And the others, they don't present with any signs and symptoms. But there is another type of, like when you have an hypertension leading from 140, type 2, from 140 to 90, you find that you may present with a headache, some dizziness, fatigue. Those are some of the things that you may have. And when you do the laboratory diagnosis, we may have some protein in the urine, and we can have some if it is prolonged, we can have some signs of organ failure. But now there is another type of hypertension, which you call hypertension emergencies, a crisis. And this is a type of hypertension whereby the reading is 180, systolic and the diastolic of 120 and above.
Yes.
That is then the patient will present with nose bleeding,
Yes.
headache, chest tightness, yani unasikia kifua iko na uchungu,
Yes.
na pia you may have nose bleeding, without forgetting the severe headache. Some of them, they have difficulty in walking, and they also present with a stroke, and others may present with heart attack.
Wow.
Yes, yeah. So that is the classical signs of hypertension crisis and emergency hypertension. Now, especially when we are doing the World Hypertension Day, we found that in MERU County, according to the data, by then on Friday, that is when we are celebrating on 17th, when we are celebrating the World Hypertension Day, it was found that we have 36,000 patients, 66,030 that are suffering from hypertension.
In this county?
Yes, in this county.
Those are the ones who've been tested and probably on treatment. Eh?
Yes, yes.
Wow, 36,000 is a big number.
It's a big number.
Wow.
Then we also have, we usually say that hypertension is a sister to diabetes. Our own brother.
Why?
Because if it is poorly controlled, you progress to another condition.
Yes.
Now we found that we have 13,087 people suffering from diabetes. Now you find that if we say it is a sister, we need to control. If you have diabetes, please control it. If you have the hypertension, control it to avoid proceeding to another kind of a condition or a disease, either hypertension or diabetes or the heart disease or the liver disease or what we call multiple organ failure. Because both hypertension and diabetes can lead to multiple organ failure. Yeah. So in that case, we call the viewer to adhere to the clinic, to them that are sick, and to them that are not sick, we prevent, because prevention is better than cure. We can have our BP checked at least once in a year. And don't go for checkup because you are sick. Just go to understand how are you faring. Even daktari wanafurahianga sana ukienda umsalimia umwambia nilikuwa nakuja kukusalimia na nijue niko aje. Si tuwe tunaenda kwa daktari wakati tunalia ama wakati uko in pain. Yani hata daktari nafurahianga kuona watu pia enye wamefurahi. Yeah, that is what we usually say. But in the entire world, it was stated that according to the WHO, that 1 out of 5 people they have hypertension in the world.
1 out
in
of
the world. 1 to 5. 1 kwa watu watano ukihesabu 1, 2, 3, 4, 5. One of them wako na hypertension na ajui.
Yeah, because now
they are working with BPs that are high, but they don't know them until when you find person akona stroke. Mkienda kupima ndio unarealize kumbe you are working with high BPs yana tukwa tunajua. So it is a serious that, but we say that when we get the information today, we will change our life and we will change the life of the community. Because as you are getting the update today, you are becoming our ambassador to tell the community and also to talk to the people that you live with. It is good they have the BP check. Actually, you are saying that this is the month of BP check.
I was going to ask you.
Yes.
What is it you're doing in the? This is the month of hypertension, the hypertension month, rather. And what is it that you're discussing? What is it you're doing in this month?
Actually, we are giving health education. Number 2, we are encouraging people to have their BP measured accurately. The one is accurately, so that we can control and live a longer life. Yeah. So when we do that, everybody, we call everybody to be ambassador. Unauliza mwenzako, when did you have your BP checked? So kama yawe chekiwa, tafadhali endo upimiwe ujijue. Because when you understand yourself, you are able to control. Kama utapimwa weight ionekane iko juu, uende ukate weight. Kama utapimwa uonekane uko in a elevated state, you identify the factors that are triggering to a elevation of BP. Then you work on those, especially what I've called modifiable factors. It will be well with us.
And what are the risks of me having maybe hypertension and I don't know what are the risk factors? associated with the disease, hypertension?
Okay, the risk factors, it's like we have people that are overweight, obese, people that don't do exercise, okay? Unaona umetoka kwa nyumba, umekunywa kachai kako, umeingia kwa gari, umeingia kwa ofisi, umekalia kiti ya nifrute nikuvute, kutoka hapo umerudi kwa nyumba, kwa gari, na hivyo. So, if you live that kind of life, make sure that at least umeweka up mapema, umefanya 30-minute exercise. 30-minute exercise.
Every day?
Every day. That one will save you. Then the other risk factors is taking much of red meat, which has got cholesterol, high cholesterol. It is known that the red meat has got high levels of cholesterol. So these cholesterols, they predispose us to the IBPs. So now we encourage us, we take even at least twice a day, and we take more of white meat. Now usiniambie pig.
I hear it's white.
It is a fat.
Oh,
so
that's what we call
white. Classically, it is not a white, it is a red meat.
Okay.
So the white meat, we have the chicken, we also have the fish. Yeah. Now, the other thing we encourage people, it is to take more of vegetables and fruits, and also stress. Stress is a risk factor. Watu wale wanakuanga na stress mingi, wako predisposed to increased blood pressure, hypertension.
Yes. Then
I've talked of taking alcohol and smoking. This is another risk factor. Yes.
Thank you very much, our viewer, for staying with us. I'd like us to take a short break now, and when we come back, I want to see your views on this topic that we are talking about. I'd like to see your questions on the same topic. I'd like to hear what you have to say about the same. Thank you so much, and keep watching. Thank you for staying with us on this show where we are learning about hypertension. You have heard so much information. We are learning a lot. The knowledge is power, and you know, when you have power now, you're able to control yourself, you're able to carry yourself, and we thank God so much for enabling us even have such guests who are opening our eyes to know some things are just not there. We have to keep doing our part to make sure we are a healthy nation. Now, as we continue with the show, I'd like to hear from our guests. What is her view on hypertension? What do you think? Is it preventable? Is it something that we can live with? To tell us much about that.
Okay, thank you, Sarah, for the opportunity, and also the viewers for joining us once again in this today's show. We are informing the community that hypertension, it is there. It can affect anybody, and it is controllable. So how and we are able to identify the risk factors. Like you have seen that the risk factors, we have smoking, lack of exercise, stress. We also have increased weight and being inactive. So when we address, we stop stress. When we avoid taking a lot of alcohol, abusing drugs, when we reduce our weight, we take more of vegetables and reduce more of red meat. And when we are there to this, we are safe. We have also saying that we can have hypertension occurring in the pregnant women, which we are calling gestation hypertension. And in gestation hypertension, we have encouraged our mothers to go for health, to go to the clinic immediately they realize that they are pregnant, so that they can be identified in good time, and we can walk the journey together with the daktari to ensure that the mother is safe and also the baby is safe.
Wow. This is interesting. Eh? So when we talk about blood pressure, you said it is about how the blood moves in the vessels. Eh? What is it now that makes it, see, that is kawaida, what makes it now become pressured, you know, high blood, pressured blood?
Like you have the thin vessel, we call them vasodilation, or you can have cholesterol fat, we call them the plaque, within the blood vessels, in the rumen. So when you have them there, you find that kuna some kind of resistance. That's when we have the accumulation of pressure.
Oh, so now it's not easy now for the blood to move. Hence now it
moves with the resistance. And now we need to apply more force.
Oh, more force for it to go. So it burdens both the heart and the body.
Yes. Actually, that we say that uncontrolled blood pressure will lead to heart failure. You end up with heart failure.
Because of overworking.
Another complication is in kidney failure.
Yes.
You can lead to blindness because the pressure, increased pressure destroys the retinas. The blood vessels that supply blood to the heart, so we end up zinavunjika. It can throw a by either in the brain, you end up with the stroke. That is another complication. Yeah. Actually, you find that when you have increase in BP, you find that there is a lot of palpitations. Unaona venye roho inapiga. Then even to remind us, when you are doing the classification of primary hypertension and secondary hypertension, there is another class that we forgot. Class yenye tunaita gestation hypertension. Gestation hypertension, it is the hypertension that occurs to a pregnant mother within 20 weeks. Or pregnancy. Yani haukuwa na pressure, but you conceive ikakuwa sasa BP imeanza kuwa juu, imeanza kuwa na BP, because of hormonal issues. So you find that at delivery, this mother is off the BP. Yani inaisha to some, and but percentage, minimum percentage, they progress with it. And others, they health after delivery, then after after breastfeeding, unknown in the future, they are at risk of developing hypertension. You can also have what we call, under the same gestational hypertension, you can have what you call chronic superimposed hypertension. That is when you had BP before you get pregnant. Now you are pregnant, you have BP, now imeanza kuinuka. You can't use the same drugs that you are using. We need to introduce to other drugs so that we can control this BP. In this case, we end up with what we call the preeclampsia and eclampsia. In the preeclampsia, usually you can have a mother presenting with high BP, akona headache, akona chest tightness, na when you do the urinalysis, unapata hakuna protein in the urine. But for signs, yani the signs and symptoms is we do a CS. We don't wait. Tunapeleka straight to theater. Because umeona tuko 36 weeks, we know that already at least our baby is safe, ako mature. Na we don't want to risk losing the mother and the baby. So the best thing at that time, according to gynecologists, they prepare the mother so that we can deliver this child at a time. For this kind of preeclampsia, we usually have the risk, high risk of losing the baby. High risk of losing baby. That's why we say it is a medical condition, na daktari wanakuanga hapo throughout to monitor these BPs na to monitor the feeds. We are monitoring conversions, we are monitoring also the BP, we are monitoring also the mother, and we are monitoring the fetus.
It's quite complicated,
Yes.
Quite complicated.
So, but most of the time we are able to deliver, to have a good discourse for the baby and the mother. You find that for this mother, wako na risk. complications ya hypertension in pregnancy. You can have what we call fetal death. Mtoto anaweza kufa akiwa kwa tumbo. Mtoto anaweza kuwa delivered before afike. Because is what we call placenta detachment. Na hii placenta inapeana chakula kwa mtoto. Because kuna poor oxygen circulation, we may end up with the low birth weight ya huyu mtoto, or we may have with a threatened abortion, or the mother can miscarriage, ama mtoto akufia akiwa kwa tumbo because of that high pressure. So we are encouraging our mothers, before you get pregnant, attend our clinic for guidance and counseling, so that your body can also be prepared to carry a baby. Then when you are pregnant, start immediately your clinic, so that now you can have a journey walk with the daktari, because you'll be advised on the danger signs during pregnancy. Like you will talk of swollen feet, kuwa na low blood, here tunaita anemia, ama kuwa na jaundice, yani yellowness kwa macho. You can also be reminded of another danger signs, whereby you talk of a baby who is not praying. Yani mtoto alikuwa anacheza lakini umeona acheza. That is another danger sign. The other danger sign, it is vaginal discharge, either wind or the watery discharge. That is a danger sign for a mother who is pregnant. And when you encounter this, it is go for medical checkup or to the hospital, so that now you can be treated in case of infection, and also you can be guided on what to do. If it is about, because most of the time when you have swollen feet and face, you are likely to have a raised BP. We do the diagnosis for the condition that you may be having, then we treat and control it. So that is what we encourage our mothers. All the same, we are saying that prevention is better than cure. How do we prevent this? Number one, we need to take a balanced diet, make sure that we take the food rich in vegetables, protein, carbohydrates, and also don't forget to take water. Then number two, we also encourage people to stop smoking and taking alcohol, because it's a predisposing factor for high BP. The other thing, we encourage our people to do exercise 30 minutes every day. It will save you. The other one is about stress management. In stress management, we say that you can identify the stress. What is causing the stress? Can you avoid the causes? Yes, you avoid them. If you can't avoid them, stage 2, you identify. If you avoid, you can avoid. If you can eliminate, uondoe. But kuna zingine you can't eliminate, you can't avoid. Now for this that you cannot do either of the two, you learn to cope with them. You cope with them, unaona, for the sake of your health. Because unaona hapa sasa, nangangana kutoa hii mesa hapa itoki. Unaona, sinilani kukaa nayo. Because hakuna lingine. Actually for identification, unasema what is causing the stress ni meza, nitoe. Haya, kama nisiwezi nikaitoa, si bandaya kupitia katikati hapa nipitie na hii side. Na nimeshindwa kufanya hizo zote. Let me cope with it. That niko na hii meza hapa na itakaa hapo, then you develop ile tunaitanga enduring mechanisms. Unakaa nayo hapo na unaona si meza. Turn into a blessing.
Now I have another question I'd like to know. You say when for those that are unwell, or maybe they've gone for the test and they find they have hypertension, how can they be helped?
Okay, for example, we have our cheese bees in the village. They have the BP with them and the random brown sugar. So we are calling upon the viewers, when you have the mandaktari wa kijiji wanakuanga na mbagi ya rendi kwa mgongo na wako na uniform. So wako na hata the weighing machine. Ukitaka kujua kilo zako, mwite akuja kupimie. Apime kilo nyumbani, atakupimia kilo, atakupimia BP, akupimia sukari na atakuadvise. So wakipima waone uko na BP, atakurefer. Sawa sawa. Ukienda pale hospitali daktari atachukua history. Aone what are the predisposing factors. Akuadvise you eliminate the predisposing factors or the risk factors. Number 2, akipima aone BP yako iko juu, atakwambia upumzike, asome the second reading. Then the second reading you'll have rested at least for 10 to 20 minutes in a resting position. Juu kikuja umekimbia tuende kupima, itakuwa juu. Itakuwa juu because you are inactive. Hata ukitoka mbio ukuje upime tutaiona ikiwa juu because your body was in active mode. No, when you are taken into a resting position, tupime tuone tena iko juu, that is the time now daktari anaweza amua kukuweka wapi kwa madawa. You start the treatment. Sasa after me identify other things, then kuna time unaweza ona kuna those predisposing factors, either chronic factors in the body. Unaweza tuma kipimo, pimua damu, one kama ngina trigger to this high BP. Unaweza pimua mkonjo, tuone the status of the kidney kwaji, na pia unaweza pimua kipimo kama ya low, kama una complain, yani kuchoka ukiwa at rest, ama ukifanya kazi kidogo unaanza kuchoka. That is a risk factor for cardiac disease. So daktari anaweza amua kukupeleka kwa kipimo, ukapimwe, ukapigwa picha kulingana na the way the patient is presenting. We try to identify what other triggers for this. Then from there unapatiwa dawa zako, unaachiwa clinic. Kama wale wako na high BP tunawapea clinic after 3 days. Wakuje tuone vile wanaendelea depending with the type of the BP that you have. Kuna tunapea after clinic ya 1 week, kuna wa 2 weeks na 1 month. But the follow-up clinic for the stable BP it is